Macular degeneration, also known as age-related macular degeneration or AMD, is a progressive chronic disease that affects the central retina or macula. There are two types of AMD, atrophic and exudative. In atrophic AMD, there are small yellow deposits. They're made up of lipids called drusen deposits. And these build up between the retina and the choroid. Along with these drusen deposits, a development happens within the retinal pigment epithelium, or RPE, of the macula. In general, it will begin to atrophy or waste away, or hypertrophy, which is increase in size. This results in the inability of the RPE to do one of its most important jobs, which is to provide nourishment to the retinal tissue. Specifically in AMD, it affects the retinal tissue of the macula, which in turn negatively affects the functioning of the macula. The breakdown of the RPE can stabilize, where the person would continue with atrophic AMD, or it can progress to the point where the person's AMD transitions from atrophic to exudative. And this progression is marked by neovascularization. When neovascularization occurs, this person is diagnosed with the exudative AMD. And how this occurs is that RPE has broken down to a point that the retina is no longer receiving the nourishment it needs to be healthy and to work. So the brain sends a message to start creating new blood vessels, and these new blood vessels tend to leak, have hemorrhages, which causes scarring and creates these central scotomas on the macula, drastically reducing a person's central vision. So some symptoms of atrophic AMD include a gradual, generally symmetrical central vision loss. And this occurs over months and years. And it can also result in a distortion of visual images. Symptoms of exudative AMD also include central vision loss, but it occurs much more rapidly. It usually occurs over just a few weeks, and it affects a large portion of the macula. Most vision loss associated with AMD is due to exudative AMD and that neovascularization. Some risk factors for AMD include genetic factors as well as environmental factors such as obesity, smoking, low dietary intake of vitamins A, C, and E, zinc, lutein, and omega-3 fatty acids, as well as an unhealthy lifestyle related to cardiovascular risk. There is no treatment for atrophic AMD. Doctors do recommend monitoring the progression through the use of an Amsler grid at home, and what this will catch is any sudden increase in visual distortion. And that sudden increase is indicative of exudative AMD, which there is a treatment for exudative AMD. It's called vascular endothelial growth factor inhibitors. And these are an intraocular shot that essentially stop neovascularization or stop the growth of those new blood vessels. And the goal of these shots is to reverse a person's AMD back to that atrophic AMD. The sooner the treatment starts, the less central vision loss the person will have. So some of the rehabilitation plans for AMD, for a person with AMD, include reading efficiency training, low vision aids, home environment modifications, and psychosocial therapy. So reading efficiency training involves training in eccentric viewing, which is using that peripheral vision instead of central vision for near tasks such as reading. Perceptual learning, which is repeated exposure of perceptual stimuli in hopes of changing neural pathways in the brain to increase efficiency of using those perceptual pathways. So in this case, this could be introducing text into peripheral fields over and over and over to increase the visual span and reading efficiency in those fields. And lastly, we have eye movement control. So working on a person's ability to fixate, their stability in their eye muscles, and making their eyes movement a very smooth movement. Low vision aids that are regularly used to help people with macular degeneration discriminate text or read text more efficiently are magnification and lighting. So magnification increases the size of the text on the macula and retina, which in turn increases the likelihood that that text will project on a healthy section, and therefore the person will be able to read that text. Popular magnification products are handheld magnifiers, reading glasses, Max TV glasses, and CCTVs. One of the negatives with magnification is as the power increases, the visual span or the amount of text on a page the person can see with that magnifier decreases. So this is where lighting comes into play. Lighting enhances the contrast between the text and its background, which makes it a lot easier to discriminate the text and increases reading efficiency. So the more contrast there is, the better the lighting. The decreased power, the lower power of magnifier the person needs to be able to read efficiently. And therefore, they increase the amount of text they can read on the page, which therefore increases their reading efficiency, increases that word per minute rate. Some popular lighting options are illuminated magnifiers, lamps, so essentially task lighting, as well as lighting under kitchen cabinets that can help with cooking tasks and reading recipes, things like that. Some changes within the home environment that can increase safety and independence for someone with AMD include the use of contrasting colors, such as two-toned cutting boards. You can have a light side for cutting dark foods, such as tomatoes, and then a dark side for cutting light foods like onions. Another way to contrast colors in the home is having dark furniture in the house. If you have light flooring and light colored walls, you can pick out that furniture easily to sit on it or to not run into it. Increase lighting in the house, as well as increased task lighting, such as lamps placed strategically throughout the house, and task lighting for reading or under kitchen cabinets can be really helpful in safety of navigating throughout the house, as well as doing tasks that involve being able to see objects up close. Clearing walking paths is another important thing when it comes to safety of navigating through the house, and introducing organization and labeling for items such as medication and foods with similar packaging. This way the person can take their medication safely and independently, as well as figure out which food is which within the canned goods section. Lastly, in our rehabilitation plan, we have the psychosocial aspect. Most of the studies included in this research paper touch on the fact that psychosocial therapy is important to include to truly enhance a person's overall quality of life. Some examples of how to incorporate this are referring someone to a psychologist or social worker to address their feelings of grief, loss, and depression associated with vision loss, to include their family and caregivers in the therapy plan, and to refer them to support groups for people with vision impairments. And that wraps up this presentation on macular degeneration.